I'd like to introduce Julie Jones, who's from Aberdeen, you can tell from her accent, who's kindly given up her evening this evening to talk to us about exercise. I first met Julie about 6 years ago, I don't know if she remembers, when she came down to Plymouth to speak about her research on the effect exercise can have on Parkinson's symptoms. And her talk was one of the things that made me realise that I really must do more exercise, and I'm so glad I took up that challenge. So thank you, Julie. So, Julie, welcome. Perhaps we could start with this question. Why does exercise help people with Parkinson's?
Wow, thank you very much for inviting me tonight, Jane. That's been fantastic. I'm more horrified that 6 years ago. It really doesn't seem that long since we had that conversation. So why is exercise beneficial for Parkinson's? I mean, this is a huge question, and I think for people really to consider, there is so many different benefits of exercise. And I think probably one, if I can start very general, and I'll get more specific as we explore this topic this evening, is very much, physical activity has been shown to be beneficial for everybody. So not just people with Parkinson's, but it's got huge health and well-being benefits for all sectors of society. So as a given, generally, people feel much better when they're participating in physical activity and they increase their activity levels. I think then when we start specifically to look at Parkinson's in particular, I think for me, the easiest way to divide that down is there's some physical benefits for participating in exercise, there's some psychosocial benefits for participating in exercise, and also there's some really exciting physiological changes that happen with when people participate in exercise for people with Parkinson's. So it's many, many different facets. And I think we'll probably touch on the sort of neurophysiological elements later. I suppose something I just wanted to quantify, and thank you, Jason, you've put some slides up there, is very much tonight's session was talking about exercise. And maybe this is something that we maybe could just discuss right from the outset, is the difference between physical activity and exercise in itself. And very much physical activity is an umbrella term, very much used as a sort of lifestyle, and very much people are encouraged to be physically active. And very much you can see on the slide that physical activity pertains to everyday activities such as walking, household chores and gardening. Whereas very much when we look at the international definitions of exercise, it's a subset of physical activity, and it's something that should be structured, planned, programmed, and something that is targeted on a particular area. And therefore, exercise, although it fits within the umbrella of physical activity, is something quite specific and therefore needs to be targeted to meet the individual needs of people with Parkinson's. So right from the outset, there's probably a slight difference in how people refer to these terms, with physical activity being a generic term and exercise being quite a specific term for something that's structured and tailored to individual needs. So if we were to touch on the physical benefits, if that's all right, Jane, does that seem okay?
Yeah, that's absolutely fine. Yeah.
I think when we talk about the physical benefits of Parkinson's, I'm very much talking about some of the motor symptoms that people see with Parkinson's. And when we look at the physical benefits of exercise, what we're thinking of is that all the research studies would seem to suggest that if you participate in physical activity and exercise, people have an improvement in muscle strength, they have an improvement in flexibility, they have an improvement in balance, they have improvement in aerobic capacity, but also it has a positive impact on rigidity, and it also has a positive impact on the bradykinesia, so the slowness of movement and the reduced amplitude of movement that people have as well. And there's been now quite a lot of considerable amount of literature, and when we look at that, there's over 1,500 papers which have looked at the physical benefits of participating in exercise. And I think that's particularly important when we look at the Parkinson's population. So Jane may be quite an exception, but a significant proportion of people with Parkinson's are classed as sedentary. And therefore, the physical benefits not only tackle their Parkinson's, but perhaps tackle some of the other coexisting conditions that people have who are perhaps less active as well. I think really the other big advantage is psychosocial. I feel with Parkinson's, because the main approach of management is relying on medication, it makes you very passive recipients of your own care. And actually one great advantage of participating in physical activities, it's something that people can do for themselves. It's something that they can do to exert control over the direction of their own condition. And therefore it has a really positive impact on on their perceptions of their condition, offering them that capability to be involved in the self-management of their own condition. But not only that, there's been an increasing amount of literature that's looked at the evidence to support group-based exercise. And there's many group-based exercise opportunities around the length and breadth of the UK, predominantly, albeit at the moment, delivered online. But that also allows that opportunity for the development of camaraderie, development of community and shared experience and learning from others. And that's really, really powerful experience for people with Parkinson's, to almost to share that and have that confidant with other people, and to really therefore have that healthy competition as a group of people working together. And I guess the other benefit is looking at some of the non-motor symptoms have also been shown to benefit with exercise. And I guess this is in a really emerging area, and there's been lots of recent studies and indeed some good quality randomized control trials that have looked at the positive impact of exercise on cognition, on improving levels of fatigue and improving in quality of people's sleep patterns. And that has also been shown to be beneficial for people with Parkinson's as well. So when we look at the gamut of sort of symptoms, both motor and non-motor, really exercise has been shown to touch on all of those particular elements and be beneficial for all those different facets for different people.
Are there particular exercises that are more helpful than others for certain activities? I remember you talking to me, I remember when you spoke, you talked about golf, and I assumed it was your arms that were the problem, and I remember you saying it was your trunk.
So I think one thing when we think about, is there one type of exercise that people should engage with? And I'm sure for any of the physiotherapists or exercise professionals that are on this call, I think that has often been the million-dollar question. What exercise should I do for my Parkinson's? What is the best type of exercise? And that's a very difficult question for us to be able to answer. And I'll just perhaps maybe just explore why that is. First of all, everybody with Parkinson's is different. So if you've met one person with Parkinson's, you've met one person with Parkinson's. So actually exercise needs to be tailored to the individual needs. So when we think of the most common age of onset for Parkinson's, it tends to be in the 5th or the 6th decade. And therefore, people may be living with Parkinson's while also coexisting with some osteoarthritis, or they may have a slightly elevated blood pressure. Or we could be dealing with people with a younger onset of Parkinson's who are living with a new diagnosis of Parkinson's while also working full time and have a young family. And therefore, the exercise prescription needs to be tailored around their ability to fit exercise in and around that busy working schedule. So the first thing I would say is that evidence doesn't point to any one form of exercise being superior to another. And therefore, the evidence would suggest that exercise needs to be tailored to what that individual individual person's needs are. And then that's perhaps why the evidence also suggests you should see somebody who has a specialist interest or has had specialist training in Parkinson's, because there's over 40 different symptoms associated with Parkinson's, and therefore you're a very varied community. And so what we need to do is think about having a thorough assessment of what your individual needs are, coupled with thinking about what are your own exercise or physical activity preferences, and combining those two to design an exercise program that's going to meet your needs. But I guess in addition to that, we need to be looking at the literature and thinking about what we know about Parkinson's. And when we think about our understanding of Parkinson's, yes, people will associate the rigidity, the bradykinesia, the postural instability and tremor being the 4 main symptoms. But also, if we then also look at some of the other literature, which has looked at barriers and motivators for exercise, and we explore why people maybe aren't so physically active, we also start to unpack some of the other issues that need to be addressed. So quite commonly, due to a variety of reasons, both related to their Parkinson's and exercise behaviour, a number of people have weakness in their muscles. So particularly looking at the lower limb muscles around the hip and pelvic area. Due to long-term changes in how people walk, that also affects the musculature around the ankle and the biomechanics around the ankle. Many people who are first diagnosed with Parkinson's, the first symptom they notice is that stiffness in their shoulder, and many of you may relate to that. Maybe have felt that you had a frozen shoulder or adhesive capsulitis, it's quite often called, around the shoulder. And that inability to swing your shoulder has quite an impact on the dynamics of walking. So if you don't swing your arms when you're walking, it reduces the rotation you have in your trunk. And if you don't rotate slightly when you're walking, it affects the dynamics of your pelvis, which then affects your limbs as you go down. So that's really why when you're going to see a specialist, they need to look at you from the top to the bottom and back up again and identify what your specific needs are. So there needs to be a strength component to that exercise program. And then also then we look at that thinking long term, there needs to be a balance element to that exercise program. But also increasingly emerging evidence would also suggest it needs to have an aerobic capacity. And I'll touch on that a little bit more. But higher intensity exercise, aerobic exercise, has also been shown not only to reduce the risk of people developing Parkinson's in the first instance, but has also been associated with limiting the rate of decline. So aerobic exercise, which gets you up a puff, has also been shown to be beneficial. But equally, when we notice some of the other symptoms around dual tasking, where you're needing to do two things at the same time, there's been a lot of fantastic work done in the UK, but internationally, that has shown that when we're doing two tasks at the same time, so a motor task such as walking combined with a cognitive task such as carrying a tray with a latte on it, people with Parkinson's will preferentially focus on the cognitive task, and as a result, the quality of the motor task, in this example, walking, will also deteriorate. And so therefore, when we're designing exercise programs that are going to meet an individual's needs, we need to have that combination of a cognitive load to it, as well as having the physical element to it. The other big symptom that I think also that has been shown clearly within the literature is this amplitude of movement. And many of you will be familiar with PD Warrior, which has come out of Australia, but also looking at LSVT, which has come out of the United States, and PWR. These are Parkinson's specific exercise programs. Similar to all these three of these exercise programs, a common theme is this really emphasis on large amplitude movements and maintaining those movements. And so again, as part of that exercise program, that's something that needs to be included. So when people start to ask me what is the best type of exercise, is the key messages is no one exercise has been shown to be superior to another. It's likely that a combination of exercises are beneficial for people, and people need to participate in a varied approach to exercise prescription. I suppose from that, and maybe I'll just ask Jason just to pass on to slide 11, Jason, would be really helpful if you can pop onto that slide just to illustrate the point that I was just going to bring up. I'll just give Jason a moment. He's the man with the tech at the moment.
And I can't work out what the numbers are. Screens have covered the numbers, sorry.
It's the one with the big circular diagram on it. The next slide, I think it'll be for you, Jason. So if we were to put that into perspective, what I was saying, very much when we look at the exercise framework, which is published on the Parkinson's UK website, or we look at this exercise wheel, which was developed by Banu Ramaswamy, what we can see here is when we're looking at the exercise is that it very much illustrates the varied approach that's needed towards exercise prescription. So if we were to think about strength and power, the current recommendations is we need to be doing strength exercises, so exercises against resistance, be it on a machine, using a band, using your own body weight, at least twice a week. We also need to be doing balance exercises between 1 and 3 times a week is the current recommendation. But also thinking about recognizing the effects of rigidity, we need to be maintaining our flexibility with our exercise. So then participating in activities such as yoga and Pilates and Tai Chi have been shown to be particularly beneficial for that. But then also we've got exercises which focus on aerobic and endurance. And if you add all those up, the smart, beaver-eyed ones of you amongst the group will realise that actually we need to be participating in some form of structured exercise on a daily basis. So it advertises more and more the fact that you need to have this diverse approach. And if we're thinking, I'm a strong advocate of Pilates, and thinking of that as a particular exercise, it's a very slow, controlled movement, holding your body in a good posture alignment. It's a fantastic exercise in Tai Chi, very similar, thinking of the poses and the breathing that's involved within Tai Chi. It is very, very beneficial for people with Parkinson's. But if we just think about that, you might think a lot of the postures that you're holding within Tai Chi are static. And although it may be very good for flexibility, perhaps you can see from that particular exercise, the benefits may not transfer into walking or gait or being able to improve aerobic endurance. So that gives you an idea about thinking about the types of exercises and the goals that you're wanting to achieve. So I suppose in answer to Jane's question, you need to participate in a varied approach to exercise, encompassing strength, flexibility, balance, and endurance-based exercise with some cognitive element and an amplitude training within that. And it's something that needs to be taken routinely within your normal working week, so that you're participating in enough exercise to address all those particular elements.
Quite a challenge to get all that in a week, isn't it?
It is, and I think that's something that I particularly like the exercise wheel. There was a lovely chap up in Scotland who developed them into some fridge magnets, and I think that's really useful. But when we're thinking about supporting exercise, I think using an activity planner is a very good idea, because I don't know about you, but I certainly find that, you know, if it's a wet day or I get busy, exercise is often the first thing that gets deprioritized, if that's a word, out of my schedule. Whereas if we're actually having an activity planner and taking some time to think about what you've got on in a week and slotting in which activities that you're going to be able to do is really helpful for helping sustain a change in your behaviour to try and instill exercise into your everyday life. And so that often is a good thing that you can be supported doing with your exercise professionals that are helping you, you know, to enable you to be more physically active. But equally, there's been a lot of work looking at the use of activity trackers, such as, you know, Fitbits or devices like that. And they're also very good to set yourself some targets, some goals, or things that you can do to set yourself some challenges to try and keep yourself being physically active.
I mean, I think I consider myself reasonably active, and most people say I do a lot of exercise, but I'm not sure I do that much.
I suppose, Jane, it depends what you do within a session. So many people, if they go to the gym, and I've seen some of the videos that you're doing, if you're in the gym for an hour, you're probably doing a combination of strength and balance exercises within that. So in a way, it's thinking about what you're doing and what you're particularly targeting. And we can learn a lot from our strength and conditioning coaches, and the fact that, you know, athletes will go to a gym and they'll have a cardiovascular day, they'll have an upper limb, so a day that focuses on the arms, they'll have a day that focuses on the legs. And I suppose what you just need to think about with your exercise professionals is planning your exercise program to make sure at some point within the week each of those domains is covered, and that you're sort of thinking about encompassing all that within an exercise program.
You've mentioned that certain exercises that we can do actually will target particular symptoms more than others. So if we went to somebody like yourself and asked them to set us up some sort of physical activity routine, they could target that particular symptom in particular for us, could they?
Absolutely. So certainly what I would be doing is I develop programs for people depending on what they need. So some people, I will actually give them a program that they have to do on set days of the week, which is very much focused at strength training. So when we look at strength training, if you're doing it in a progressive manner, you might not want them to do it every consecutive day. So I would give them a strength program to do on, say, a Monday, a Wednesday, and a Friday, and then on a Tuesday and a Thursday I may focus on balance and flexibility, and then within that on the weekend I will be building in some higher intensity exercise as well. So thinking about structuring those different components in. However, equally, I have a number of patients who are very busy and perhaps don't have as much time to devote to exercise. And therefore, what I might do with their exercise program is that they say to me, I can do an hour 4 times a week. And therefore, I have to then think about adapting how I can maximize what I'm putting in their exercise program for the 4 hours that they feel that they can give to exercise. And I think that's something that is really important. It's not about me telling people what exercise they should do, because I generally think that's not effective. It's having that conversation with the person who you're prescribing the exercise and having some honest discussions about what they can fit in and when they can fit it in, Because if there is that mutual discussion, I find it's a lot more effective for them to be looking at long-term adherence. And and I equally like to sort of share some of my own ideas in terms of that. So I have two children who are both, I've got one who's 13 and one that's 11. So those of you been there, I'm at the sort of glorified taxi stage where I take my children to football, to music, to after school clubs. And so, I have to fit my activity around them. So at guitar, I'm running around the local village for half an hour when my son's at guitar. I'll go and do some circuits in the gym while my son's doing football. So I have to, because the rest of the time I'm working, or perhaps sometimes I might have to do the housework. So it's thinking about what time do I have to fit in activity around that. And I think it's important for people to build that in so they can be more likely to adhere to their exercise programs. And thinking about other things you can do, and thinking about, does it need to be something Parkinson specific? And I think Parkinson specific exercises such as PD Warrior are very good because it gives you something that's tailored specifically to the symptoms. But also I recognise that some people don't like to go to exercise programs that are specifically named, and you'd rather do something more anonymous. So, people can go to Aquafit, people can go to Zumba, people can go to, any form of exercise. And then, your exercise professional can liaise with the person who's delivering that. Or indeed, Parkinson's UK have just released an awareness training programme, which then can be shared with those instructors so they can accommodate how they're delivering maybe the Aquafit to accommodate people's needs. So there's a lot of collaboration needs to go both with the individual, but also with the community that delivers exercise as well.
Julie, there's a couple of questions that started to come up in the box. One is a good one, how to cope with loss of motivation, because I think that's one of the big problems that a lot of people with Parkinson's, because it is hard when you're not feeling very well to be forced to go and do something ghastly in the gym can feel quite tough.
Do I think that's tough for everybody. I think that's tough for everybody who wants to be physically active, but particularly for people with Parkinson's who have a lot more fatigue and often suffer from apathy. I think that's a really, really difficult one to do that. First of all, I'm quite sympathetic. You're allowed to have a bad day, and you're also allowed to have a day off. You can't have them every day, and you can't have them all week, but you have to give yourself, to start with, just have a reflection on what you've done in the last few days and just question whether you've been too hard on yourself. The next thing to think about is what strategies you're going to put in place. Great things that I find work clinically, and again, there may be some exercise professionals on the call that may agree with this. I think having somebody that you exercise with is something that really makes you get up and go. So if you've got an exercise buddy, that's fantastic for adherence. We're very British. British people don't like to let people down. So if you're meeting, Susan in the park at 10 o'clock to go Nordic walking, you won't let her down. Whereas if you're going Nordic walking by yourself, you're like, doesn't look very nice weather out, or maybe I'll just finish doing what I'm doing in the kitchen. So having an exercise buddy is something that I think is very, very positive. And thinking about choosing who you want to do that particular activity with. So thinking of that and building in some social connections along with your physical activity is a good one to get started. Setting yourself some goals is useful. So whether that be a step count or setting yourself challenges as well. And the other thing I find useful recently is keeping an activity diary. It does seem a little bit strange that a number of people feel low in mood and they don't have much energy, but actually they go out and they do something, they come back feeling so much better after they've been for a walk. And sometimes keeping an exercise diary is a good memoir of, actually I did that the last time and I felt so much better when I came back, and just being aware of how your body feels. So you can do that in a variety of different ways. So a reflective diary, an exercise buddy, setting yourself some goals. I have a number of people that are now starting to use Strava, and so looking at the routes that they're doing and sharing routes with people online. So again, it's building that network of community people that you can share your exercise with.
Yeah, well, I definitely take up on most of those. I do challenges, and I always book on a class because otherwise I'm absolutely useless at getting to anything. So that's fair enough. There's a couple of other questions that are coming up. Somebody has mentioned they have back pain and sciatica and muscle pain, and how can they exercise without being in acute pain?
Oh, okay. So I think that's a difficult one and to start with, but again, you're somebody who perhaps needs a slightly individualized approach to your exercise, because a lot of people do complain of back pain. And again, that could be a symptom indirectly of Parkinson's due to a lot of the stiffness that you get at the bottom of your spine, particularly in the lumbar spine and around the middle part of your back. And also the postural changes that many people experience. So I think probably what I would do with you is start very gently thinking about limbering up the lumbar spine and improving some of the movement there before we can start working you up to doing something more progressive with your exercise program. And I think that's always something to think about. We all need to start with a different exercise. Although I mentioned high intensity is where we want to be, you've got to recognize that everybody's going to start somewhere different. So if you've had severe pain for a long time, I would start with fewer exercises, build yourself up gently so that each fortnight you're building in a new exercise and you can reevaluate your pain. If you add in one exercise and there's no change, you think that exercise is okay. If it brings on your pain, you think, well, it must have been that exercise that I added this week. So it allows you to reflect on the exercises that you're doing. But again, I think if you've got that, I would start gently with some flexibility exercises, start with some walking. Nordic walking is also very good for low back pain. Thinking of starting something gentle and functional, and then thinking about focusing something that's a bit more structured and focused in relation to your Parkinson's. Exercise does help low back pain. There's clear evidence with or without Parkinson's that improving your mobility is beneficial.
I just had a lovely comment come into the chat box, which is from Rosemary near me here, and she says having a dog makes you get out and exercise. And I remember my mother being told by the doctor once that everybody over the age of 60 should be prescribed a dog to make them get out and do something. So there you go.
Oh, I think that's a great idea, Jane. If we could get that in the next manifesto, that would be super. Yeah. People would love a dog.
Yeah,
right, we've got a couple of admin questions in there, Jason. We'll just let's clear up quickly.
Okay.
Carolyn asked, which organisation are Jason and I from? We're not. We're actually just people with Parkinson's who are volunteers. We run this as a volunteer thing. So we're not from any organisation at all, which is quite nice. And there's a couple of people asking if they can have access to the slides after the session, Julie. If you
Of course. The slides are very much today were just to augment almost this exercise conversation that Jane and I are having. But I have created them so they would stand alone for people as well, for people who wanted to view them after. So by all means, I'll be happy for Jason and Jane to share them. That's not a problem. And also my contact details are on there if anybody wants to, who's been too shy, or if we don't address their questions tonight. I'm very happy to answer any questions that people might have afterwards.
Okay, another question from Heather. Heard of PD Warrior, but what were the other two exercise programs you mentioned?
Okay, so the other two programs I mentioned, some of you may have heard of it. It's the Lee Silverman voice therapy, and some of you may have heard that as a particularly Parkinson's approach to improve voice projection and amplitude of your voice. Now, that particular clinical and research group in the United States developed a sister approach, which is called LSVT Big, with the idea it's about big movement. So it's still called the Lee Silverman voice therapy, so the LSVT, but it's called LSVT Big. And they have, again, 8 core moves, which really think about emphasizing large amplitude movements, because very much the thought is, or the science behind Parkinson's is that we think that a lot of the movements, the amplitude of the movement decreases, and the fact that people with Parkinson's necessarily aren't aware of how small the amplitude of movement there is. The problem, and the reason why amplitude is so important, when we're thinking about walking, we're normally moving, our arms and our legs are going in a similar motion. With a reduction in amplitude of movement, you lose that swing. So that's a primary symptom of Parkinson's. But equally, what happens with time is those muscles become shorter because we're not using the full range of movement. So we also get some muscle weakness, and we also get some muscle tightness. So that need to get that large amplitude of movement is really, really important. And it's very much stressed within the LSVT Big program. And again, making that concerted effort to get big movements is also in PD Warrior. The other month I mentioned very quickly, and you're right to pick me up on it, was PWR. So that's Parkinson's Wellness Recovery Programme. And that has actually been developed by Becky Farley, who originally was part of the LSVT team. It's not commonly used here in the UK in its purest form, but it's certainly something through the hub, the Parkinson's Excellence Network Exercise Hub, what we've been looking and pre to COVID, we were looking at seeing about getting some training and development opportunities for exercise professionals here in the UK to bring that approach partly more into clinical practice here in the UK.
Okay, getting a couple of questions coming up about more about the scientific evidence of physical and high intensity exercise. So if we can take that in a minute, let's just a few comments that people have put in. Gary said he's done LSVT and it was completely changed his life, which is nice to hear. Sarah has said, who's a doctor, says she often wants to prescribe a dog. So that's good to hear as well.
Rosemary said you could borrow a dog as well.
Yeah, that's right. So a few people are offering to loan dogs, so that's okay. Is there a suggested time that when starting to change exercise or other things for it to become regular? Is this about 6 weeks? Do you have to do sort of 6 weeks to get yourself into the swing of it?
I would say for habit forming, there's a variety again of different schools of thought of this. I think people need to be going 6 weeks is the absolute minimum that you would need to get habit forming. So I would possibly say in reality for habit forming, I think you need to be looking at least 8 to 10 weeks. The other reason for that is when we look at how your body responds to exercise, so from a physiological or a cellular basis, if anybody was to start an exercise program today, physiologically, you wouldn't necessarily see huge improvements for anything less than 6 weeks. And of course, we think about the Parkinson's population and the predominant of that population being over the age of 60, you possibly find that that will take even longer. And therefore, for habit forming, I think we need to be looking at longer than 6 weeks. So but just at that stage when people are starting to really feel the changes in how their muscles look, the benefit from a cardiovascular point of view is also, you start to notice it. So habit forming, I would say absolute minimum of 6 weeks, preferably the evidence would suggest somewhere between 10 and 12 weeks is an optimal duration.
Okay. Somebody has asked in the Q&A, how do they get advice on getting an individual program? Who should they provide? Who would provide it? I'm guessing you'd say a local neurophysio would be ideal, wouldn't they?
The gold standard, I think, probably would be for a first consultation. Yes, would be super if people could be referred to a neurological physiotherapist who has a specialist interest in Parkinson's. And I'm saying that, and I'm very much saying that that's what I would say would be the gold standard. However, I do recognise, and we can see this from the various service improvement audits that are run each year by Parkinson's UK, that not every consultant or not every GP surgery in England will have access to a neurological physio. So I think, therefore, I recognise there's some limitations in the current service position developed within the NHS. So, from that perspective, I think your first port of call would be to see a physiotherapist, and they hopefully would be able to signpost you to somebody who perhaps has more expertise in that particular area, or liaising with your Parkinson's nurse team, who also will have a better idea of who the Parkinson's specialists are local to your area. Also down in England, they're very mindful, thinking, even seeing some of the people who are on this call today, there is also a huge range of private physiotherapists, particularly working in the south of England and then into middle England, too, looking at who develop and deliver specialist services privately for people with Parkinson's, if that's an avenue that you're prepared to consider.
Okay, another question is, have you come across Reach Your Peak? I think somebody from Reach Your Peak's actually on the call tonight.
Yes, I've come across Reach Your Peak, and a huge shout out for Reach Your Peak. So for some of you who don't know, so this is Reach Your Peak, and Sally and Maria are based, I think I'm right in saying, in Wales. So they deliver an online Parkinson's specialist delivery of exercise for people with Parkinson's, and they were ahead of the curve, or as it would be, in the fact that they have always delivered this online, even before COVID. And I think something that's very unique to their particular program is the fact that it isn't just about exercise prescription, it's about supporting people to make meaningful changes to their exercise, and it's about delivering exercise contextualized with Parkinson's education. And I think that's something that I think is particularly important. Just telling people to exercise isn't going to shape their behaviour, but something that's very much embedded within the work that Sally and Maria do is trying, when they're delivering and teaching people to do a particular exercise, is telling them why that's beneficial for their Parkinson's, why they're getting to do so many repetitions or sets of that particular exercise. And I think that really helps people to understand why they're doing those particular exercises. And they also provide boot camps where there's lots of education seminars and webinars trying to bring people together to share their experiences, but also to educate people on their Parkinson's, which is very similar to the programme that I run up here and are currently researching in Scotland. So it's thinking about exercise programmes delivered in isolation perhaps are more, well, have a better impact if they're delivered along with sort of strategies to support behavioural change, strategies to support self-management, and really trying to give people the knowledge, skills and tools to be able to exercise independently within their own home. So yes, big shout out for Reach Your Peak, huge. Go check it out.
Gary tells me that Irish set dancing has been shown to improve gait, balance and movement. And I bet it would.
I think dance is a cheeky one, actually. You know, I like dance, and there's lots of and again, there's some people here on the call tonight that have done some research into looking at dance within Parkinson's. And I say dance is a cheeky one, and I think it's a cheeky one because a lot of people are put off by the term exercise because it means weights in a gym and lots of lycra, which many people maybe find difficult to associate with. But dance is cheeky because I think it's more of a social exercise, but actually it gives you everything you need for Parkinson's, and even, you know, various different types of dancing. If you think about ballet, we're looking at composure, we're looking at slow movements, we're thinking about postural control, we're thinking about breathing. We're thinking about tango, we're thinking rapid changes of direction, we're thinking about poise, we're thinking about speed, rhythm, timing. And if we think about Irish set dancing, my goodness, we've got lots of movement, we've got lots of timing, it's very high intensity aerobic exercise. So different types of exercises, they're cheeky exercise because you don't feel your exercise because it feels so social when you're doing it. So there's a lot of evidence looking at the benefits of dancing. And also the fact that even partner dancing, it has that social element. And again, I think if you can go exercising with a friend or your partner, that in itself, it motivates you and it feels more social. So a big, you know, and again, I think that's so important when I mentioned about exercise, there's not one type, it's got to be something that suits your preference. If you were a dancer, then go dancing. That might be your exercise of choice. I, however, have no sense of rhythm and I'm not a dancer, and putting me in something like a Zumba class where I had to dance or a salsa class is my worst nightmare. So again, it's thinking about what you enjoy and embracing it.
I'm with you on that. Right, I think we ought to get on to talking a bit more about the evidence. There's a few questions about aerobic exercise. Is there any references to that? Is there research being done on the value of exercise in reducing and limiting the amount of drugs we have to take? There's lots of people actually asking the question about what evidence is actually now available? Why is it? What's happening that makes it improve or slow down Parkinson's?
So high intensity exercise is something that's really come to the fore. Probably in the last sort of 5 to 10 years, it's really become an area of interest. And particularly for me as a physio, this is where I think exercise suddenly becomes really exciting and really is a big positive motivator. So we've known for a while that exercise is beneficial in terms of limiting the rate of decline. But actually what's emerging evidence predominantly started about in 2010 to sort of 2014, very much coming out of animal models to start with. They demonstrated that particularly that those who participated, so rodents which participated in high intensity exercise had a slower rate of decline of developing of the symptoms of Parkinson's than those who didn't participate in high intensity exercise. So it started to make them explore as to why this may be and what are the factors that perhaps are causing that. And that's very much why there's been a huge amount of evidence have emerged really in the last, as I said, 5 to 10 years, because what we're looking at is exercise has suddenly become probably the most positive avenue towards disease modification. So considering that medication has quite a short term and we haven't improved on sort of, you know, any medication that provides neurorestoration or neuroprotection, exercise has become very positive and very much perceived to be the beneficial factor. Jason, if I could just ask you to move on to the next slide, that would be super. Possibly in the other way. Yeah, that's fine. So why do we think this is actually working? So very much there, the neurophysiological benefits. So thinking of that, first of all, they think it may have improved people's symptoms, and the fact that drug effectiveness or efficacy is improved with high intensity exercise. If you're exercising at a high level, it increases your heart rate. And if you increase your heart rate, you have cardiovascular, that increases the blood flow to the brain. Increasing the blood flow to the brain brings far more oxygen, which is important for neuronal health. It brings glucose to that area, and it brings all the substances to the area that we need to promote an optimal environment to keep neurons living as long as possible and functioning as optimally as possible. So the first thing alone, just from exercising, is that you're by producing a more optimal environment to promote neuronal health. And that's important in Parkinson's, when we're aware that the primary cause of Parkinson's is where neurons are actually dying. The other big thing that they've noticed from looking at animal studies is the fact that high intensity exercise is associated with increasing the circulation of what is called neurotrophic factors. And some of you may have actually heard of. So if you just go into the next slide, Jason, as well. So really, neurotrophic factors are proteins within the system, and they're required to maintain neurons. They're there to promote survival, so the lifespan of a neuron. They're also there to help support maturation, so the growth of them, and also to support the number that are produced. And the key neurotrophic factors that we've seen that are associated with exercise is your BDNF and your GDNF. And you may have heard of those terms before, and the fact that there's been big research studies trying to increase the level of these substances within the brain within Parkinson's. So BDNF is brain-derived neurotrophic factor, and GDNF is glial-derived neurotrophic factor. But also exercise has been shown to increase insulin-like growth factor as well as vascular endothelial growth factor. So really what we're seeing with higher intensity exercise, these normally occurring growth factors are actually increased, which has been shown to promote and sustain neuronal health within people with Parkinson's. And I think from that point of view, there's a huge amount of emerging evidence suggesting that high intensity exercise is the most promising treatment for neurodegenerative conditions, in particularly Parkinson's. If I could just go back to the previous slide, sorry, Jason, just moving around. So that's the first one, high intensity exercise, increased levels of neurotrophic factors within the brain. In addition, what we're also noticing with higher intensity exercise, it also has some other impacts within the central nervous system. So it also improves or increases the production of dopamine, which you produce within your brain. And that's obviously positive when we've got a condition where there's a reduction in dopamine. It also improves the transmission of dopamine, so the traveling and absorption of dopamine within the system. And it also improves the selectivity of the dopamine terminals. And so they're the parts of the brain which are taking the dopamine and allow that neurological information to be transferred within the brain. There's also evidence suggesting that people who participate in high intensity exercise, also it's been shown within scans within human brains that we get increased synaptogenesis. So just to explain what synaptogenesis is, when we think about the neurons within the brain, we've got one neuron and it passes information on to the next neuron, which passes information on to the next one. And it gives a command within the brain, which is then executed and allows us to move. So the more synapses we have, the more traffic our brain can deal with, and therefore the quality and efficiency and effectiveness of our movements improves. So we've got more ability to transfer electric current if we've got more synapses within the brain. We've also shown that high intensity exercise increases neurogenesis. So that's the birth of more neurons. And generally, as we get older, the number of neurons which exist within our brains start to decline. So high intensity exercise is really then shown to preserve, but also promote the generation of more neurons within the system. So really what we're looking at with high intensity exercise is not only does it potentially have that capacity to make changes within the brain, but we're also therefore getting to see that potential for restoring some of the dopamine cells within the brain and protecting those neurons from being lost in the future. And so for me as a physiotherapist, I find this particularly exciting because it's not just the health and well benefits that we were talking about in the front end of the show tonight. It's about the fact that actually by participating in exercise, we could actually have a positive impact on the condition trajectory for people. So that's really why there's been a really big push for higher intensity exercise for people with Parkinson's.
How do we know when we're doing high intensity then?
Good question, Jane.
You can attend a class that says it's high intensity, but you don't have to do it at high intensity, do you?
Okay, so you're absolutely right. And maybe if you just move on to the next slide, and I'll just touch on that in a moment. There's been lots of evidence here, and I've just put some examples, and some of these are randomized controlled trials, some of these are systematic reviews where they've taken evidence from several studies and collected them together. Jason, if you just move on one slide. So what we start to learn is that a single bout of exercise is not superior. So we need to have a program. So it starts to tell us to improve these levels of neurotrophic factors. Just exercising once is not enough. So people need to participate in a program of exercise. So that's important. What also is important, these systematic reviews have also demonstrated, which is really exciting, is the fact that increased levels of BDNF, so a particular neurotrophic factors, has also correlated with improvements in the Unified Parkinson's Disease Rating Scale, particularly the motor subsection. So by raising these levels of neurotrophic factors, not only are we going to potentially get the neuroprotective element and the neurorestoration, but we're also improving people's symptoms. So you're getting three things for the price of one. So these systematic reviews are particularly exciting. If we move on to the next slide, I'll maybe just answer your question, Jane, that you're looking at. So what is moderate to high intensity exercise? So if you wear a particular gadget that measures heart rate, such as an activity tracker that I've got on here, very much at the moment, we're sort of thinking that moderate intensity should be somewhere between 60 and 65, or even up to 70% of your maximum heart rate. So many of us, kind of, if you're old school like me, maximum heart rate used to be 220 minus your age. It's a sort of guide. So you need to be working at 60 to 70% of that for moderate intensity exercise, whereas high intensity exercise is 75 to 85% of your maximal heart rate. Now, if you don't have a device, then I find an easier way to use that is using what's in the table here, which is your rate of perceived exertion, where you're scaling how tired you're feeling. And so therefore, if we're looking at moderate intensity exercise, you need to be exercising somewhere between 13 and 15, which says somewhat hard. And I translate that into you should be able to speak, but not in full sentences. So, oh, I'm working hard. And so you should be out of puff, but still being able to speak. Whereas maximal intensity is really classed at anything above 15 on the RPE scale. And therefore, again, you need to be really working hard, and you might need to pause and then be able to speak. So you certainly in moderate to high intensity exercise should be getting a sweat on, you should be going pink, and you should be getting out of breath. What also the evidence would suggest to us is that we need to be engaging in higher intensity exercise 4 to 7 times a week. And also higher peak intensity exercise has been shown to be a better indicator of exercise than just the number of hours that you're doing. So what it is really suggesting to us when we're looking at the sort of neurophysiological changes associated with exercise, it's the frequency and the intensity which you're doing it are key important factors. And these tend, therefore, we need to be thinking about aerobic exercise that's really pushing us. And again, on the next slide, there's a particular study of interest that some of you may wish to read. A lot of the high intensity exercise studies which have been published to date have used forced cycling or treadmill training. So therefore you have to keep going at that rate and pace, which while can be done in a laboratory or under supervision can be quite daunting. But there was this paper published by O'Callaghan, which was done in the northeast of England and really done and published last year, but was conducted in 2012 to 2016. And interestingly here, they use more of what I would say is probably seen more clinically within physio, within leisure centre facilities, where they did high intensity circuit based training. And so they got people working at just over 85% of their maximal heart rate, and they got them doing 45 seconds of high intensity work and then gave them a 15-second rest. And they did that 4 times for a course of 12 different exercises. So it very much is a very interval rate training. So this study really demonstrated there was significant improvements in people's BDNF in the HIIT training group, so high intensity interval training, more so than those in the moderate training. So what we're not suggesting is that you need to be high intensity the whole time. What we're suggesting, or the evidence is increasingly suggested, it's thinking about intervals where you're working for brief bouts of high intensity and then a rest. So up to 2 minutes and then some more high intensity and then a brief rest. And so again, it's thinking about when you're going out walking, how could you build in high intensity? So when you're out walking, many of you will be living in urban areas. So thinking about, I'm going to walk, and for the next 6 lampposts, I'm going to walk as fast as I can safely. And then for the next 3 lampposts, I'm just going to go back down to my normal pace. The next 6 lampposts, I'm going to nail it and walk as fast as I can. Again, if you want to increase the load, swing your arms faster. That again will increase the cardiac load. So you can introduce some sort of HIIT training into your normal dog walking experience for those of you who have dogs or have a dog on prescription. So thinking of that, this is the big learning that we're getting from this. We need to be doing it frequently, and the intensity is really important. Does that answer your question, Jane?
Yeah, it does. I think anybody watching you on the street might think you've gone mad, though. But apart from that, there are a few more questions in the box because we're running towards the end of the session, really. It's one of those. Catherine asked, do you have a reference for aerobic exercise making the difference? Is that one there probably the best one?
This one certainly will. And any of the systematic reviews on the previous slide, and I've left on both the authors and the DOI, which is the bit you can click. But again, Jane, if anybody struggles to get any of these papers afterwards, they can contact me, depending on what your journal access is. I might be able to share them for them for people who'd like, but most of these are aerobic. This is one of the first papers, this Callahan paper, that wasn't specifically aerobic only training, and I think that's probably more akin to what we see in clinical practice. But yes, I can share them, but they're on the previous slide as well.
Okay, another question. What is the best exercise for core stability?
Core stability. I think for me, if you're a very beginner, I would say some core stability to start with, starting gently, would be thinking about some Pilates would be useful. It helps with the flexibility and very much targets the core, and then dynamically moving into Tai Chi to allow you to have some breathing control and some more dynamic postures would be useful for that, which then can be built into a more dynamic program thereafterwards.
The next one, thank you. The next one is somebody who needs to use a frame to get around. What's the best way for them to exercise?
So I've run chair-based exercise programs that are high intensity. It's about keeping people exercising at a rate and keeping them high and then bringing them back down again. So just because you're in a chair or walking with a frame, there's no reason why you can't engage in higher intensity exercise. So I might get you marching on the spot for 1 minute with high knees, and then I might slow down the knees for 2 minutes where you've got some strength component for those leg movements. And then I might then start doing some arm exercises, raising your arms up for 1 minute, and then go back down to doing some side stepping with the hips, which is looking more at resistance or strength-based training. So you can really change it up, even if you're sitting or don't feel confident standing up. It's still possible to get a higher intensity workout, regardless whether you're in standing or sitting.
Right, okay, thank you. Are there any particular types of exercise that particularly help with a tremor?
Now, this is really interesting, and recently there has been a systematic review looking at tremor, and tremor is often one that is very difficult to be able to manage. But things you can do is thinking about exercises which involve a sort of rotational component in the upper limb. It helps with the rigidity, but also with the tremor. Also thinking about task focusing work can also be very beneficial. So think about aiming for a particular target. So thinking about the common one that's used in PD War, thinking about the overhead throw, which has power and gives you a target to aim from on the wall. So something, get a ball above your head, a softball, throw it. And that again, that power and the control and focusing your attention can help reduce the tremor. Also, weight bearing exercise, so particularly for people who have a lot of tremor in their hand, thinking about if you can get down on all fours in that sort of position, and weight bearing through your hand can also help reduce the tremor symptoms that people have. And when you're down there's lots of Pilates-based exercises you can do for your core when you're there.
I'm glad you've explained why when you throw the ball at the wall. I never understood what that was for, so now I know.
Oh, it's for power, real power, and speed, but also does help with your tremor. And if they're cheeky, they'll fit in a lunge with it at the same time.
Jill asks, why can I run when I can't walk?
Simple answer to that. When you're running, you're thinking about it and you're concentrating. When you're walking, you're not concentrating. It's because thinking about the function of the basal ganglia is where all the well-learned movement patterns are stored, so you learn how to walk. And when we walk, none of us really think about, I'm putting my right foot down and my left foot down. As soon as you increase the rate and pace, you're using a different part. You're using the frontal cortex at the front of your brain, so it bypasses the basal ganglia and you do much better. And that's very similar to the theory behind auditory cueing. For those of you who use like a metronome and a beat, as soon as you have a beat, you're focusing on the beat and getting your arms and legs to move with the beat. So you're no longer using the basal ganglia, where those pathways are sometimes delayed or interrupted with Parkinson's. So it's the concentration in a different part of your brain that you're using.
And I have one last question in the Q&A box. I can't believe it. We've answered 27 questions in there. Are there any research programs related to Parkinson's exercise that could be involved, that we could get involved with, which might also help with motivation? So, is there any, being in a research program, would it help someone get exercising?
There is a number of exercise programs, and then this my own study, which is currently already underway, is certainly one piece of work, in Parkinson's UK have jointly funded my study along with the Chief Scientist Office. So yes, there is some studies undergoing. There hasn't been so many studies looking at exercise delivery in the UK so much in the last year and a half because of the pesky virus that's poking around at the moment. But increasingly, I think there's some studies coming along this way, which we're actually going to look at how exercise is delivered. Because one of the challenges, we know it works, we know it's beneficial, but it's how we can support people to develop an exercise habit that is the big bit. And we need to think about how services are configured to support people with Parkinson's. And that was very much how my study emerged, in the fact that I think there's some fantastic exercise opportunities, but often with NHS provision, people only get a time limited opportunity with their physiotherapist, and then they're sort of left dry with no sort of motivation. Finding community-based exercise programs which are delivered by fitness instructors can be difficult. So again, I think what we need to be thinking at, certainly what we're working with the Excellence Network and the Exercise Hub, is thinking about how we can shape services so that we're supporting people to initiate an exercise habit, shape an exercise habit, and maintain that exercise habit. And I think that, to me, we need to get exercise to be part of everyday management, and get that to something that's mentioned in that first or second conversation that you have with your neurologist or your geriatrician, whoever you see for your Parkinson's. I'm not currently aware at the moment of any studies in the UK which are recruiting for exercise delivery at the moment, but I should imagine with restrictions starting to lessen, these will start coming back on board, because certainly the study that was produced late last year, that was commissioned by Parkinson's UK, the Simpson study, demonstrated how COVID has really negatively impacted on physical activity participation in the UK, just due to the fact that exercise was pretty much closed down overnight. So there's a big need for people to participate. Jane, can I just do one shameful plug?
Yeah.
For those of you who are new to exercise and don't feel that they want to attend a group because they don't know if they're going to like it, as part of COVID, the Exercise Hub pulled together a great number of Parkinson's specialist exercise professionals, did some videos of 30-minute classes, and these were published on YouTube. And it might be useful now that gyms are starting to open up. There's fantastic yoga sessions, there's some high intensity exercise sessions, there's some yoga, there's Tai Chi sessions. It might be useful for some of you just to have a look at these so you can have a taster of a high intensity session, or a yoga or a Pilates or a chair-based exercise that allows you to sort of try before you feel that you would want to sign up for that in a leisure facility, or sign yourself up for a Parkinson's class. So I will make sure that when we circulate the information, can say that link is there. And there's, as I say, there's several of these exercise videos that some of you could try just to start putting your toe in the water, because going to an exercise class is difficult. With or without Parkinson's requires quite a lot of self-confidence. So it would be good for you guys to have some experience before you go, so you know what you're letting yourself in for.
And also there are quite a few online courses as well. So I do my PD Warrior online. So
Yeah.
you can do a lot of these things, so you can try both before you have to face a class. I do understand that's quite hard.
Yeah.
Yeah, okay, and they're very good actually. I looked at the high intensity ones, wondering if I was going to think it was really good or not, and they were, so they are very good. Yeah, weight bearing in a wall press up, would that provide sufficient weight bearing to help a tremor?
Yeah, that would be a good start. You could start weight bearing on the wall with 2 hands, and then you could progress it, taking 1 hand away and bringing it back. So I'm building in some rotation while this arm's pushing against the wall, and then you could swap them over. Yep, you could also do a press up against the wall and bring your arms back. So hands against the wall and bring them back. So you're working on that extension. And can you see that it just suddenly becomes a big movement where you're one-handed and your arm back there. Yep. And equally by doing that, can you see how I'm building in some rotation as well? So you're combining those exercises. Yes, you're getting the weight bearing and rotation and a stretch. So it's combining those elements together. So you're not having to do hundreds of exercises, but we can fit several things into one exercise.
Okay. A comment in the boxes from Fee saying the East Devon Parkinson's group have restarted their exercise classes after COVID, and they've attracted 60+ people this week. So that's really good news. And David asks, do you do private consultations?
Do you know, I don't really do many private consultations because I'm a rubbish private physio. This is my passion. This is my hobby. And so very much what I always like to do, I'm very happy to speak to people about what they want to do and point them in the right direction and sort of mentor them through that. I'm very mindful. I live in the northeast of Scotland, which is a long way away from a lot of people, but I'm very happy to get people started and provide them with some programs that they can start to build. You know, I think it's really important. I very much feel a call of duty. I have a certain skills that I, as a physio, and I'm very happy to share those to get people started, because I'm very humbled at the moment. I've been spending all day collecting data on my study, and even those people in the control group who've now just feel that it has been the single thing that has changed their life. It has made them feel that there is positivity. They can now successfully live with Parkinson's rather than be defined by it. And I think I'm really, really quite positive about the value it brings for everybody. And if I can help anybody with that and get them started on their journey, I'm very, very happy to do that. It's a huge boost for me to see people feeling better about themselves, even if it maybe doesn't show a positive thing on a scale. The fact that they feel better because they're contributing to their own health is enough. And it's really humbling for all the therapists on the call. I'm sure that they'll find that is the fact that the empowerment and the passion and also just the stronger that they feel after engaging in exercise mentally as well as physically is so positive. So happy to help in any way that we can.
So my thanks to everybody who's been attending, and to Julie and Jason and Martha. Thank you so much for giving up your time this evening.